Good afternoon, everyone. It's a pleasure for me to talk about something I'm passionate about. My mission is to empower all nurses here today and make you understand how important nurses are in general and especially in stroke care. I would also like to share with you our experience in Spain empowering stroke nurses. I just want to know, can you please raise your hand if you're a nurse to know how many of you are here? Nice, fantastic to have so many of you here. Okay, so nurses represent one of the largest segment of the healthcare system. 19.3 million nurses around the world. But despite this majority, nurses are underrepresented in policy decisions. We nurses must see ourselves as leaders, and we should be prepared to lead the change to advance in health. We are on the front line of healthcare, yet we are too often undervalued and our contributions underestimated. And this, as you might predict, leads to nurse staff turnover and burnout. We usually have too few opportunities to develop leadership, so we have to move to a power position in which we are included in policy and decision-making. Nurses are one of the most influential staff on patient outcomes. Less nurses means more mortality, increased readmission rates, and at last, more cost for the healthcare system. So nurse staffing cuts to save money might adversely affect patient outcomes. As you see in these studies, it is demonstrated that nurse staffing and education has a great impact in patient outcomes and mortality. More studies related to stroke also demonstrated mortality reduction and better patient outcome when a nurse intervention is performed. So these days, our job includes more documentation and technology and less time at patient bedsides. So you will agree with me that we need a change, and we need nurses to be more proactive in order to make those changes. If you take a look, 35% of our time is consumed recording data. And then we do not exploit this data, so we have to use it and to create evidence. And we need nurses to record the data and use it and publish this data in high-impact journals as the ones I showed you before. And please remember a dissemination strategy for others to see, understand, and apply to practice. So now let's take a look on stroke care and how it has improved over the last few decades. Stroke was considered in the past by many health professionals as a sad but untreatable condition. Many patients didn't even get a brain CT and only received passive care by nurses. Nowadays, thanks to all the advances, stroke care, a patient can receive acute treatment and expert nurse care. A significant moment in the evolution of stroke care was in 1997 when the first treatment for acute stroke was approved. Since then, there's been a big push through the acute medical services to get people into emergency departments as quick as possible. We now have acute stroke units in a way we didn't before. There's still work to do, but we are really on it. And even fewer people die from stroke than ever before, the condition still remains one of the biggest health challenges of our time. Specialized training for nurses has demonstrated significant improvement in delivering of stroke care, reduced door-to-needle times, increased independence rates, evidence-based practice, and positive synergy within professionals. If you take a look, the nurses are included in every step of the stroke care, from prevention to stroke treatment and recovery process. From the very first contact of the patient with the emergency medical services, the ambulance will alert the we'll bring the patient to the nearest hospital, pre-alerting the stroke team. The patient may even receive thrombolysis if it's a mobile stroke unit equipped with brain CT. At the hospital, the stroke team will be ready for doing thrombectomy or whatever treatment the patient is able to receive. At the stroke unit, the patient will receive inpatient stroke care by expert nurses. Nurses will be intensively monitoring vital signs and neurological status to prevent complications. And patients will also receive early mobilization and rehabilitation. Nurses can make the difference for stroke patients. A nurse-led intervention has proven to reduce death and dependency rates by 16%. With 3 simple protocols. During the first 3 days, by 4 daily measures, nurses will prevent complications by managing fever, sugar, and swallowing. If you haven't yet, you still have the opportunity to join this European study led by Professor Middleton. You can check it in the Angels website or by talking to us. The patient will receive a discharge plan by nurses with risk factor advice, support, and also information about the stroke. In our stroke center, we use complement information. We have a website, a mobile app, and also tablets for patients. So now I would like to focus on the activities related with the empowerment of stroke nurses in Spain. In Spain, we have this Society of Neurological Nursing, which is really focused on stroke care, and we have worked really close with the Angels Initiative in order to implement activities to empower the nurses in Spain. So one of these strategies was this one I show you here. It's a grant for a 1-week stay at the National Reference Center. Here I show you a photo of our team with one of the granted nurses, and I have to say that it was really a very enriching experience for both sides. We shared our nursing protocols and continue to collaborate in multicentric studies. Angels also provide this course that was certified also by our society, and it was translated into Spanish in order not to have a language barrier. And I cannot finish my talk without talking about the Nursing Now campaign. It's a 3-year global campaign aiming to improve health globally by raising the profile and status of nursing worldwide. Because nurses play a crucial role and are the key of the universal health coverage. The campaign will focus on these areas, giving voice to nurses, more investment, more nurse leaders, more research, and sharing best practices. And as you see, it's worldwide. So, in summary, I would like to insist on the fact that the change has to start with us. We are almost 20 million nurses around the world, and we reach everywhere, from birth to death, and provide 24/7 care. So the voice of nurses needs to be heard. We need more nurse leaders to implement changes and take part in policy decision-making. We need to do more research and disseminate our results in order to create evidence. As I show you, the training of nurses is very important, so we need more training and full competencies because it has a good impact in patient outcomes. And the change has to start right now. The actions that we and our fellow nurses do today will have a great impact in the future, and we cannot wait to start this change. So please, take an advice of what I told you. And I also wanted to thank the Angels Initiative for the support and for seeing the nurse potential. Thank you very much.